Fellow Guyanese, I am Dr. Karen Gordon Boyle, and thank you for joining me for today's COVID-19 update. Now for the global statistics. According to the World Health Organization, the total number of cases is 11,669,259, with 539,906 deaths. In the region of the Americas, the number of cases is 6,004,685, with 268,828 deaths. I will now bring you the situation in Guyana. As of July 9th, 2020, the total number of positive cases is 286. 125 persons have recovered, and our COVID-19 deaths remain at 16. In institutional isolation, we currently have 145 active cases, 19 persons in institutional quarantine, and 6 persons in the COVID ICU. Fellow Guyanese, I wish to provide you with a disaggregation of our current data, which indicates the following. Region 1 is currently managing 69% of all active cases. 46% of all positive cases have recovered. 6% of all infected cases have died. A current survey conducted by the Ministry of Public Health in collaboration with UNICEF has indicated the following behavior patterns. Respondents from all 10 administrative regions have indicated that the level of fear of becoming infected with COVID-19 has decreased from 81.6% to 53.5% over a period of 4 weeks. 30% of respondents reported that they are unwilling to give up their daily practice and adhere to guidelines provided. Over 70% of respondents indicated that they wear a mask when out in public. 58% of respondents indicated that they observe the 6 feet social distancing as per guidelines. 76% of the respondents indicated that they wash or sanitize their hands frequently. The information above indicates that most persons are aware of what is needed to prevent the spread of COVID-19. Therefore, it begs this question: what is preventing you from acting on your knowledge? Fear moved from 82% to 54%, indicating that there may be fatigue when it comes to the public's response to the messages concerning COVID-19. It is important that you understand that despite the 6% death rate, that there is no prediction as to who will have a fatal case or a mild one, and therefore, it is in your best interest to prevent infection in the first place. 30% of you are unwilling to give up your freedoms in order to adhere to the guidelines that could save your life. At the same time, 70% of you have made the sacrifice for ourselves and fellow man. Guys, get with the program. Where is your regard for the lives of others? The majority of you are indeed observing the protocols, and so it's just for the few stragglers to join the bandwagon. Friends, the popular adage, prevention is still better than cure, is still applicable. And more so in the case of COVID-19, where there is no cure and we are up against a new coronavirus that is constantly mutating. So let us put our COVID-19 knowledge to good use. We continue to witness the misuse of the face mask and wish to advise that wearing your mask only because it is a requirement to enter some public spaces is not the principal reason for its inclusion in our guidelines. The mask is needed for your protection as well as the protection of those around you. It helps to prevent those tiny droplets from infecting you and those around. Further, it does not work in isolation. It must be supported with practicing physical distancing and hand washing. I wish to discuss our children whom I see riding the minibuses, completing errands for parents in the shops, market, or stores without the protection of a mask. In some instances, parents are protected, children not so. Please remember that our assets for the future are our children. We do not wish to put them at risk. So if you plan on sending them to the shop or market, please ensure that they are appropriately attired with a face mask. We continue to screen and test persons from the endemic regions and ask that persons continue to come forward if you are experiencing symptoms or if you have been in contact with someone who is positive. As you traverse our dear land, you will encounter many checkpoints, especially at the locations considered as the entrance to the regions and some communities, so please use them. We wish to thank the healthcare workers and volunteers who show up every day to complete this activity, recognizing the risk but demonstrating courage and understanding that they are needed under these circumstances. Fellow Guyanese, you are being challenged to do your part. Respect the curfew, wear a mask, practice physical distancing, wash your hands frequently, and only venture out if absolutely necessary. Stay home and stay safe. Thank you.